بسم الله الرحمن الرحيم. أعزائي طلبة السنة الرابعة, fourth year undergraduate student. Today we will speak about the history taking in surgery. I know that most of you will say that we hear surgical history taking or history taking from different department, and it's something which is repeated. Please try to take these lectures from its title, which is Communication with Surgical Patients. And I think that it will be different and it will add a lot of things to your skills and your behavior as a doctor in the future. Second things that which I know that most of you is concerning about, does this lectures containing something which will come in the exam, in the MCQ or some or not. I'm assuring you that most of it is coming in the exam. About 9 common questions is coming in the exam and repeated from these lectures. Let's start with communication with surgical patient as another aspect of surgical history taking. Objective to be covered during these lectures will be define effective history taking, describe component of patient history, outline patient interviewing techniques, identify strategy in obtaining history, and there is a difference between techniques and strategy which will be clarified to you, techniques facilitating history taking, and lastly special challenging situations, how we can deal with it. First, what is the history taking? It's a conversation which is between the patient and his doctor, but it is interviewing in systemic way, recording necessary medical information and the classical examination signs. This has to be recorded very, very precisely. All information must be documented precisely and accurately, and it is aiming to reach diagnosis. This aim is aimed from both directions, from doctor view visions and from patient visions also. So you have to know that you and the patient is joining or cooperating with each others to reach the diagnosis. What's the importance of history taking? It helps to reach a diagnosis. This is the most useful, important things for your level of education now, but it also helps in formulation treatment plan. For example, some treatment is suitable for some age groups, some treatment is prohibited in pregnant patient or something, and so evaluate medical progress by taking history taking, especially in some chronic disease like diabetes and hypertension. You evaluate the medical progress of it. It is important for medical legal recording and medical legal protection, because when you go to the court as a witness or as a offending some act which you do, you have to document it from a recording files or documents. Also, availability of information from history taking will be helpful in research, reportable disease like AIDS. Also, insurance claim is very important. Each things you are documented precisely is help the patient to claim his insurance recovery money. This is an example. I will let you read it. It's a common sentences which you can hear from a lot of patients, but it is not systematic and it's not useful, because you can't answer this question. What is this with that patient? Which body system is affected? His liver, his eyes, since when this started, and lastly, what treatment he received and does it help? You cannot answer any questions. I will let you read it again. So this is an example of bad interviewing, bad conversation with the patient, which is not a history taking we need. Types of patient interviewing. Initial history taking, this is the main one which we are concerning about in these lectures, but there is another type of patient interviewing, like inward daily round, progress of condition, results of investigation, response to treatment. These will be evaluated daily. Discharge interviewing, when you plan at home what the patient will do. Does he will work? Does he is going to a bath alone? What type of food he can eat? What type of dressing he will do for the wound? etc. Follow-up visit. We will ask about new symptoms, signs since last visit, drug management, and development of any progress or regression of the disease which you are following. Lastly, field research or screening questionnaire is another type of patient reviewing, which including questionnaires about daily activity for a normal, healthy, not diseased patient. General rules. It's not just completing a form. History taking is not just completing a form. We found some doctors that just fill the form without any thinking about what he is writing. Please tell patient your name and explain why you are seeing him. It's very important, especially if you are a medical student, and this will break the barrier between you and the patients. The history taking could be started before patient talk. You can see that the patient is in pain by his facial expression. You can see from his walking, limping, that there is something in his limbs wrong. Give patient to hold your attention. Don't take history taking while you are eating a sandwich, or you are playing with your mobile, or you are looking for different things or watching TV. This is very, very irritable for the patient and he will not cooperate with you. Doctor should be an enthusiastic listeners. So you have to be good listener if the patient is speaking about his medical conditions. Consent. Should we take a consent to have a history taking from a patient? By the way, this is one of the MCQ questions. Yes, you have to take a consent to take a history taking. First, we have to know there is a different type of consents. First, there is an oral consent. If you ask the patient, could I have some information about your disease? And the patient said yes, this is an oral consent to take a history taking. Behavioral consent, if you ask the patient to go to the couch and uncover his abdomen for abdominal examination, and the patient did this without any interruption, this is a behavioral consent to do examination. Lastly, written consent, which you are concerning about most of the time. This is needed in surgical interference or taking a special medication for a long time, and lastly, for any invasive procedure, even if it is investigations. Why we took a consent? Because if I get the consent, I can get adequate information about the case, about the details of the behavior, and about the details of symptoms, and ask about a lot of things. And also, this avoid medical legal complaints against me, because I have to take the consent to treat the patient and have an information from the patient about his disease. And this will protect you in the court. Set the stage. What does this mean? By taking this conversation between the doctor and the patient, it is like an act on theater, and this place has to be set up. First, provide safe environment. You have to have a private room to talk with the patient in. You cannot take a history of patient while he is walking in the corridor surrounded by people. Your behavior and appearance is very important. Your clothes has to be clean, tidy, ironed, and your face, your beard, haircut should be formal, not bizarre. Shake hands is a good things which give a confidence of the patient, but take care, we have a corona COVID-19 epidemic now, and shake hand is prohibited. Avoid the patient personal space means have a space, clean space, and good space between you and the patient while you are talking with him. Inquire about patient feeling if you feel that the patient is not on ease, and we will explain in details. Avoid unfamiliar or street terms. You cannot put these words during your conversation, like الحوار, قشطة, ماشي يا معلم, يا باشا. This is a street term, and you cannot use this term in your conversation with the patient, or you will lose most of the respect of the patient to you. Note taking is good, especially if there is a points which you need to document it, and you afraid that you will forget it. But don't write down each word the patient is telling you. This is wrong. Signs of uneasiness, this will be explained by what we call body language. For examples, these are some examples of body language. Smiling means you are uncomfortable, but biting lips is not a good sign. Raising your eyebrows with a little smile, this means that sarcasm. A lot of movement during the stage, the sitting, or the sessions will mean that he is worried and he is not on ease. Yawning means that he is boring from what he is doing in this point. Guideline for taking a case history. Questions should be open-ended, engaging. What about your eating? What about the feeling you felt in your head when you woke up, but not a strict one. Guidance of conversation, but not restricting it. Leave the patient speak if he speak about his medical condition, but if he start to speak about a family business or things which is not important for the history taking, try to readjust the conversation quietly without any strong behavior. Avoid leading questions with answer of yes or no. For example, don't say, do you have a diarrhea? It's better to say, what about the motion in the bathroom? Does differs from in the past, or something like this. Clear and specific questions. Don't ask a question like, how do you feel? This is not a clear and not specific. Or what about your disease? This is not a specific, but clear and specific questions. Ask about his desire to eating. Does it differs? Does you feel any abnormal things in your tummy after eating, for example? Does the swelling affecting your motion or your sensation? Ask one question at a time. Don't ask 2 or 3 or 4 questions and waiting for the patient to answer. The patient will hang up like the computer hanged, and he will not answer any. Ask one question at a time and wait for the answer. Cover various aspects of the diseased organ. Usually in 80% of cases, after halfway of history taking, you will get an idea about the organ or the system which is affected in this patient. For example, if the patient is complaining about repeated vomiting, obviously his diseased system is the upper GIT system. It's not his eyes or something. And you have to cover about the appetite, anorexia, any hematemesis, any abdominal discomfort, dyspepsia, and ta. Direct questions may be required sometimes, but put it at the end of the history taking. You have to ask directly about, are you drinking alcohol or not? This is a direct question. He should answer it, but make it at the end of the history taking. Patient symptoms in his own words. This is a very, very good point for the examination, and it has to be explained. Patient symptoms in his own words doesn't mean that if the patient said, I am complaining of blah blah blah, you write complaining of blah 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 wrongly. What's meant by patient symptoms in his own words? This means that the doctor is prevented from adding a symptoms which is very common in the patient disease, but the patient didn't complain of. I will repeat this explanation later. Special situation. If the infant is under 5 years old, parents is interviewed. But take care. In some children, Even in 5 years and younger, you can take information and get very useful information from him. Unconscious patients, you have to take the history taking or getting information from the surrounding people around him. Under a drug effect, you will take the history taking, but you write down a note that this is under drug effect, and this history taking had to be repeated after 1 day or something when the drug's effect has come. In shying patient, you have a special strategy to encourage him to speak more and more. What about emergency situation? What about these situations? Road traffic accident, multiple trauma. Is this a time to take a history taking, and is it important or not? The answer is yes, yes, yes. There is no diagnosis of any disease without history taking. History taking cannot be ignored at any time. But make it fast and don't ignore it at all. Do it fast and do it simultaneously with the procedures of ABCD, which is life supporting measures. In case of emergency, obtain information from patient or surrounding pedestrians or witnesses. All what we said before is the introduction. Now we will start our detailed lectures about classical history taking. I think this is repeated, but I will go it fast. The name is important because it has to be full, four names at least. It has to be accurate. It helps better in communicating with the patient if you called him with his name. Medical legal aspect, because in some cases you will be recalled in the court for discussion of a file of the system, of a file for patient you managed him 4 years ago. You have to write down his name fully, because this will differ from a file to another file. Age of the patient is important because date of birth is better, because if the patient is come to you to visit you at a repeated visits, date of birth will be better than the age, because the age is differs, but date of birth didn't. The growth and development is noted. Some patients said that their age is 20 or 24, but you feel that he's short, as in dwarfism or something. Certain diseases correlate with some ages. Poliomyelitis is in young age only. Cancer is common in old ages. Management technique according to the age. If the patient has cytotoxicosis and he is 20 or 25 years old, it's better to have surgery. But if he is 50 years old or she is 50 years old, you can treat her with iodine isotope to abolish the cytotoxic manifestation. Sex is important. Some diseases show sex predictions. The most famous example is hemophilia, which is common in males. These are questions which is repeated every now and then. Ethnic and religious consideration is important in sex. For example, in Arabic and Muslims, they are better to cover their hair or something if she is female. Marital state is he or she has any difficulty with childbirthing, infertility, if the patient is pregnant now or something. Contacts address. Some endemic diseases is common in some endemic area inhabited by some people, and the phone is the best way to communicate now as a mobile number. Nearest kin is very important, especially if the patient is undergoing an operation. Occupation, this gives you an idea about socioeconomic status. Race, some certain disease is common in some races, like for example basal cell carcinoma is common in white persons living in sunny areas. Religious certain consideration, which we took before, I spoke for it before. Some religious prohibit circumcision, for example, and some others asking for it. Lastly, you will have to write the date and type of admission which you are giving to this patient, and lastly, hospital number you gave to the patient. The chief complaint. Chief complaint is the most important symptoms that the patient come with. or it's the first symptoms that cause patient to seek medical advice. For example, the patient can come to you and ask him what you are complaining of. He said, I'm complaining from splenomegaly. Can you write down splenomegaly is a symptom of the patient? No. You will try to ask him, what did you feel that make you go to the doctor? And then the doctor diagnose as splenomegaly. Often the chief complaint is one of these four things: either pain, bleeding, abnormal function like diarrhea or vomiting, observation of lump. In surgical field, observation of lump is the first one to be a chief complaint. This is another questions to be considered. If patient has many complaints, always record patient's own words. This means that don't add a complaint which he didn't tell about. In order of the severity is better. In order of severity is better during emergency situation. But in chronological order, this is the classical way in called elective situation, which is the usual orders in your life as undergraduate students. So if the question comes, you have to put it in order in severity of order chronological order. The better is order of chronological order. Present history is a details of symptoms and their progress. It's the details of symptoms, so you cannot explain or giving a details of a symptoms which are not mentioned it in the symptoms in the main complaints before. If the patient added another complaint while he is speaking with you, you have to add it in the complaint first and then give a details in the present history. Should be well organized, clear details, and should also cover all the symptoms you mentioned in the main complaint. It's important to get right back to the beginning of the problem in the present history, but as in these photos, it is very, very, very old. This is wrong. It's very important to get right back to the beginning of the problem of the present disease, the present history, including these items. This is a general frame to give you an idea about the information which you took during the present history. First, you have to have all information about the etiology. If the present condition is congenital, for example, traumatic, inflammatory, neoplastic, or autoimmune. If it is without any known causes, there is a predisposing factors of some diseases. Most of the cancers has a predisposing factors. You have to mention all the predisposing factor by either positive or negative information of the present disease which you are suspecting of. Second is the classical cause of the disease. Each disease has a classical cause. For example, the hernia is presented as a lump at the anatomical site of hernia, increasing on size with effort, decreasing on lying down or resting. This is a classical course. It is applied to all hernias. And the same is the classical course of the goiter, classical course of a varicose vein, classical course of breast lump, benign or malignant. So you have to take the main or mention the classical cause of the disease. This has 2 points. First, it increases the suspicion of this disease while you are taking the present history and it's going with the classical cause of it. But if it is not in the usual way of the classical cause, it gives you a suspicion that the disease you are thinking about is wrong and you are thinking in different way. Third thing is complications. All the disease we have in surgery had complications. You have to mention in the present history either the case you are dealing with is complicated by one of the complications, which is or there is an attack of complication in the past, like 3 months ago, 4 months ago, and how they deal with it. Fourth point is the local regional effect. Any lump at any region or any pain at any region of your body has an effect on this region. For example, if you have a lump in your elbow, you have to ask about the movement of the elbow, the movement of your hand. Do you feel any burning sensation or abnormal feeling in your hand or fingers? This is a local regional effect of a lump itself. And also the pain can cause decreasing of movement, of limitation of movement, or special gait like limping. Last point is the systemic effect. Some diseases have systemic effect, for example, cytotoxic goiter. Some, for example, hepatic insufficiency or hepatic failure. These diseases also it is affecting the thyroid or the liver, but it has a systemic effect on your body. So during present history taking on these conditions, you have to ask about the systemic manifestation of this disease. You have to ask about the palpitation, insomnia, loss of weight in the goiter and cytotoxic, and you have to ask about tremors, level of consciousness and dizziness, maybe ammoniacal encephalopathy symptoms or something like this in hepatic insufficiency. Lastly, at the end of the present history, you can add a negative symptoms or negative informations. Negative information should be included if they contribute to the diagnosis to help exclude other possibilities. And please put it at the end, the last line of the present. What about the past and medical history? It's better to conjoin past history with medical history, because the chronic disease which you have a medication for it. This is a simple A B C D E F G H I J K. This is a simple way of the different common chronic disease which can be affecting patient, and it has been considered in the past and medical history, but it is very long to be recalled. So the best thing is to ask the patient about is he taking a regularly medication for chronic disease and what this medication is. Please ask about diabetes by name, because some of the diabetic patient is controlled by diet only. Family history, including any health problem because of death of patients or parents or grandparents, brothers and sisters, and previous similar illness in the family member. Potential of hereditary disease would be considered in this situation. Reproductive history is long in a female, but it's also in a male. Infertility and post-sex would have been asked about. Gynecological cause of abdominal pain is very common and confusing with different surgical diseases. Pregnancy and lactation has to be written and confirmed if present. Also ask about contraceptives used in both sexes. Habits, all habits are bad except exercise or sport. So smoker is bad, appetite, good appetite or obesity is bad, alcohol is bad, coffee is bad, sexual information is bad, but exercise is good. What about sensitive topics? Sensitive topics like, are you drinking alcohol or are you using drugs or addicting for some drugs or something? Physical abuse or violence, especially in young persons and adolescents. Sexual issues and psychiatric problems. These are sensitive topics. How we can ask about? Sensitive questions guidelines including respect patient privacy. You have to ask these about these conditions in privacy. Even avoid asking him in front of the husband or wife or his parents or sisters. Please take the privacy with the patient in this situation more important. Be direct and firm. Ask questions direct and firm. Don't ask about what about other things. He will not understand. Ask about, are you taking alcohol? Are you taking any drugs? Or are you adding or addicting to some form of drugs or injections? Avoid confrontation. Avoid something which looks like addiction. No, just be direct. Be non-judgmental. This is very important. If the patient says to you, I'm a heavy smoker, don't take a special face expression or bad impression about him as he is a heavy smoker or even drinking alcohol or something. No, non-judgmental. Use appropriate language. Ask a patient about what you are asking about in appropriate language. If the patient in front of you is low social standard, Ask about him in his language. Document carefully. Don't add anything more. Don't add anything less. Use patient own word as possible as you can. Special challenges is the last point to be discussed in these lectures. Some patient has silence, don't speak. On the other hand, others is overlying talkative patients. Patient with multiple symptoms. I'm complaining of headache and swelling in my little toe and vomiting and I'm losing weight. Anxious patients who is very nervous and asking why you are asking about this point. I have something bad. Those anger and hostility, especially in the ER where you can be hit very easily. Crying and depressing, especially with bad news. Confusing behavior or histories. Confusions, like he is speaking about abnormal relationship with animals like dogs or cats. Strange. Some people has a limited intelligence. All this is a challenges. All this has to be taken cautiously and be treated one of it at a time, and one of it with a special situation which may be not suitable for others. So please take care to be firm and very professional while you are dealing with a person with these symptoms. Developmental disability also, like he has some mental disability or physical disability. Barrier to communication. Sometimes other persons which you are taking history from is from other country, especially this problem with the Malaysian student, or he is from other society. For example, persons from Siwa in Egypt, they are speaking a different language at all. This may result from social or cultural difference or sight, speech, or hearing impairment. Attempt to find assistant to aid in communication. It's very easy to have one as a translator from you to him and from him to you. Patient encouraging. Let patient continue talking as he is talking about his medical condition. Facilitations, like saying, tell me more about it, please go on, I'm interested to hear about it, or go on. Repeating. It's usually happened at night. This to confirm a special situation in the history taking. You can repeating to confirm a special point. Confirmations. To clarifying. What do you mean by fruitful? What do you mean that it come worst? It's exactly what the pain looks like. Do you mean this or that? خاطب ناس على قدر عقولهم. Ali ibn Abi Talib. Finally, explain to the patient what's going on. Encourage patient to ask questions which is not clarified to the patient, and explain to the patient next plan or next plan you will be decided to for him. Thank the patients, and date and signatures of the sheet is very important. Don't please, don't false quick diagnosis as a malignancy, debilitating disease with bad news. False reassurance may be tempting. Avoid early assurance or over assurance unless it can be provided with confidence. Thank you very much. This is the website of our units, and thank you for your